Hey guys, it is 10 a.m. on the dot. I'm right on time today. Today we are talking all about how to manage an IBS flare, so a flare of symptoms. Oh gosh, I'm a mess. It's been a bit of a rushed morning. For those who don't know me, my name is Joanna Baker. I am a dietitian and a registered nurse, and I founded this group, so I started this group back in 2017. Initially I started it because I wanted a place where my patients could connect with other people who were having similar struggles, and also a place where they could sort of ask questions and get support about recipes and things like that, where everybody could sort of come together as a community and share products and recipes and things like that. And the group kind of grew from there, and it's developed a bit of a life of its own now, but it's a lot of fun and I really enjoy it. So at the moment I'm trying to do a few more Facebook Live events. I'm doing them once a week on a Friday at the moment, so if you've got any suggestions for topics that you'd love me to talk about. So far we've talked about eating out, we've talked about food chemical sensitivities. Today we're talking about how to manage a flare of symptoms. I'm thinking next week we're going to talk about lactose intolerance and dairy sensitivity, and I'm looking for any more ideas. I'll stop for a couple of weeks over Christmas, so I'm going to be away over Christmas, and then I'll pick up again in January, so I need lots of ideas for topics that we can talk about. Anyway, here we are. Like I said, dietitian, registered nurse. I specialise in IBS and food sensitivity, so that's pretty much what I do day in and day out. I also have IBS and food sensitivities myself, so I'm not just doing it from a professional perspective, I'm doing it coming from a personal perspective as well, and I'm more than happy to share bits of my story along the way. So I think if we can sort of all come together, it's always a good thing, and it's nice and supportive. It's nice to know that you're not alone with these things. So how to manage a flare. So where do I want to start? I've got my notes, but I always kind of like to talk a little bit off the cuff as well, because then I find it becomes more natural and sort of examples and things sort of end up coming into the discussion. So I want to start out by saying that the low FODMAP diet is not a game of perfect. It's not intended to be a game of perfect, and we actually don't want it to be a game of perfect either. FODMAPs cause nasty symptoms that are absolutely debilitating, and they absolutely impact on your quality of life, but they don't damage the body. They don't cause harm. They're not going to shorten your lifespan, and they're not going to damage anything. So essentially, if you're doing any blood tests or sticking cameras into anywhere or scans or anything like that, everything comes back normal. What IBS is it's really a disorder of the gut-brain axis. So we find that the nerves in people's guts are oversensitive, and they are essentially responding to, so the nerves in your gut, that one of the jobs is that they collect information of what's going on inside your gut, and they sort of relay that information back to your brain up the gut-brain axis. FODMAPs, there are a large group of FODMAPs that are FODMAPs for everybody in the population. So I find this is kind of the easiest way to explain what I mean. So in absolutely everybody, the FODMAPs go in, they pass through, they go through the stomach, they go through the small intestine and into the large intestine. In the large intestine, they get fermented by the bacteria that live there, which creates gas as a side effect, and they also attract water into the bowel as well. Now, this happens in everybody with some of the FODMAPs, particularly onion and garlic and wheat and those beans and those oligosaccharide FODMAPs. This is happening in everybody. Now, the thing is, the people who have got IBS have got oversensitive nerves in their gut. And when you create gas in the intestines, that stretches the walls of the intestines and it pushes on those nerve endings. And if those nerve endings are oversensitive or over-responsive, they're going to respond to that stretching of the intestines. Whereas somebody who doesn't have sensitive nerve endings, the nerve endings are not going to respond to that. So they're essentially treating normal digestion as if it's something dangerous or scary that needs to be addressed. Whereas in somebody who doesn't have IBS, they're just saying, the nerves are saying, oh yeah, this is nothing, this is just normal digestion, we're going to ignore it. So if they're oversensitive, they're going to over-communicate with the gut-brain axis. They're going to overwhelm the brain with stimulus. The messages between the gut and the brain are going to get scrambled and going to get mixed up. And the brain really, with pain anywhere in your body is still produced in the brain. So the information is collected from the outside of your body, from your senses, your sight, your smell, your taste, all of that stuff, from your inside body through the nerves and your gut-brain axis and all of that. And the information is sent to your brain. Your brain then interprets that information, and it uses past experience, it uses current situation, and it uses future expectations to decide if this information is dangerous or not. And if the information is dangerous, the brain will send back pain messages as an intention to get your attention to make you change what you're doing and correct the situation. So a really nice example is if you put your finger on a hot element, your finger collects the heat sensation, sends that heat sensation to your brain says, oh wow, this heat is going to burn my finger, that is dangerous, I will send pain back to that finger because it's going to get your attention and get you to move your finger. The exact same thing is happening in IBS. The gut is collecting this information, it is sending it to the brain is going, I'm overwhelmed, this is too much, I can't cope with this. I know in the past there's been pain when I'm assessing the current situation, the person might be feeling anxious or something else going on there. So this is bothering me, which means I want to get you to change what you're doing. So I'm sending back pain messages to get your attention. And really, this is what's going on in IBS. So there is nothing essentially to heal physically in the body, but there are symptoms going on. So when we use a low FODMAP diet, that reduces the gas produced in the intestines, and it reduces the water drawn into the intestines, which reduces the stimulus to those gut nerves. So the gut nerves have less to respond to and they relax a little bit. Now, pain can be a learned reflex response. Our nervous system, we have this thing called neuroplasticity, which means that our nerves, they learn and they grow. And if they learn to be stressed, then they will remember that. So next time they're in that situation, they're going to respond more quickly. So it becomes a learned response. When we use a low FODMAP diet to manage IBS, we want to reduce the stimulus to those nerves. The nerves then relax a little bit, they become less responsive, and hopefully over time they are going to relax even more and your tolerance is going to improve. And that's also where things like gut-directed hypnotherapy come into the picture as well, is that the gut hypnotherapy actually teaches the nerves to behave in a different way. And it also teaches you to think about your symptoms in a different way, which in turn affects how your symptoms are experienced and how your nerves respond to those symptoms as well. So that's where it's all a little bit complex. But what that means is that FODMAPs are not dangerous to the body, and they do not have to be avoided at all costs because you're going to harm your body by eating them. The whole point of a low FODMAP diet is just to reduce that stimulus and make you more comfortable to improve your quality of life. And if your symptoms are so painful and debilitating that they are really impacting your quality of life and affecting your mental health, that's when we want to intervene, and that's when we want to start looking at what strategies we can use to reduce the stimulus to those nerves, whether it be gut hypnotherapy or FODMAPs or another diet or something else. Whatever strategies we're going to use, those strategies are essentially designed to improve your quality of life by reducing your symptoms. What that means is we use a FODMAP diet to work out what foods are involved in triggering your symptoms, but once you know what foods are your triggers, what you do with that information is entirely up to you, and there is absolutely no wrong or right with doing that. And it's not my position to sit here and say, oh, that's a trigger food for you, you cannot eat that food, and slap you on the wrist when you do eat it. What it means is that once you know your triggers, if you choose to avoid that food to manage your symptoms, brilliant. If you choose, if that improves your quality of life, then absolutely that's the right decision for you. However, sometimes quality of life, because we don't only eat for nutrition, we eat for enjoyment, we eat for pleasure, and we eat for social connection. And if you've got a Christmas dinner with your family or your friends or your loved ones coming up, and it's out in a situation where you know you're going to be exposed to one of your triggers, you might decide on that situation that eating one of your trigger foods as to be part of the event and be part of the party improves your quality of life more than avoiding that food. And then knowing that you might Potentially, you may not. Look, I see a lot of people get away with eating a trigger food and not having symptoms occasionally. But if you choose to eat that trigger food and put up with the symptoms the next day, then absolutely you can do that as well. And if that's your best way to manage your quality of life on that day, then absolutely that is the right thing to do for you. So IBS really becomes this balancing act where you've got food restriction on one side, you've got food relaxation on the other side, and in the middle you've got your quality of life. And it's really about balancing these two things that are going to give you your best quality of life. And the answer to that doesn't have to be the same on every day either. It can be different on every day, on different days. So you can reassess, you can change, you can juggle, you can tweak, all of that ultimately to improve your quality of life. The other thing with IBS that I want to talk about a little bit here is that IBS is a balancing act, because that's a nice kind of segue, we're balancing things. So IBS is a balancing act. The best diet for you is the most liberal diet that you can be on and still be, and then not have your symptoms impact on your mental health. So we want you to expand your diet as much as possible. And what that means is that you're often kind of teetering on the brink. And there will be times that you bump over your threshold accidentally. And there will be times that you don't. And look, unfortunately, I would love to say I've got a magic wand, I can make it go away and you're going to be able to eat absolutely anything. And certainly have strategies that help that stuff. But we can't, there is no cure for IBS at this point in time. So it's not like I can say, take this pill and it will all be gone away and you can eat anything you like and your IBS will be cured. So IBS becomes a balancing act, and part of that balancing act is teetering on the brink of symptoms sometimes, and choosing to eat something or accidentally eating something and potentially getting symptoms as a result. The other thing is that symptoms are not always caused just by food. Stress and anxiety are part of life, and there will be times that you will be in a stressful situation, and if your gut nerves are responsive and active, sometimes that stressful situation can be enough to trigger symptoms as well. So what I'm getting at is that having symptoms is something that kind of becomes something that you have to live with at times with having IBS, and it's a balancing act to manage those symptoms. Now, those symptoms, what I found in my personal experience and also in my experience with working with people, is that managing those symptoms and having a plan of how you're going to manage those symptoms when they do happen makes them less scary. And it also means that you feel less stressed about having those symptoms as well. And if you feel less stressed about having those symptoms, then all the nerves in your body, including the nerves in your gut, are going to be less stressed about having those symptoms. And the symptoms are not going to be, as we're going to reduce the severity of those symptoms as a result. So that's a really long-winded way of saying why I want to talk about managing symptoms, because having IBS, they are something that will happen at some point, and we really want to have a plan of how we're going to manage it. So when I'm talking about an IBS flare, I'm talking about the fact that IBS will give you good days and bad days. And when we talk about a flare, it means that your symptoms are worse than usual, and they're starting to interfere with your day. So everybody in the world has fluctuations with their gut. Everybody finds it a bit more difficult to have a bowel movement sometimes, and everyone finds that it comes out a bit looser sometimes. Everybody has a little bit of gas sometimes. What we care about, and when we're talking about a flare, is when that stuff is painful, when it's interfering with your daily life, when it's affecting your mental health, and when it's stopping you do things. And that's the stuff that we really care about. And look, it might involve things like bloating, cramping, altered bowel movements. These might last anything from a couple of hours up to a day or so. We usually find if it's a FODMAP thing, FODMAPs have usually left your body within, 72 hours at the most. We expect symptoms to occur around that 4 to 24 hour mark, because on average, that's how long it takes for the food to travel through and reach your large intestine, where FODMAPs do their thing. It can take, so normally they would start before about that 24 hour mark, And they can last up to a couple of days for the FODMAPs to sort of travel through that large intestine and then leave your body. By the time they've left your body, we expect those symptoms to have settled down. If you have somebody who's had a lot of diarrhea and you've become a bit dehydrated, or if you're somebody who has been constipated and you're feeling a bit sluggish, it can take a little bit longer before you feel normal again. But we don't expect symptoms to last more than a day or a couple of days at the most. And when we're talking about extreme things, if you've got flares that are lasting several weeks, or even months, so I've seen people commenting in the group that they've been in a flare for the last 3 months, that's a sign to me that it's not just one thing that you're eating that is triggering this, or you're eating or if you are eating one thing that's triggering it, you're eating it on a regular occasion. And that's when it's time to actually check in with a specialist dietitian to do some troubleshooting. Because if your symptoms and your flares are lasting a couple of weeks to months, then what you're doing is not the right strategy to manage your symptoms, and we can get you better results than that. So that's when we would start checking in. So in terms of what causes a flare, there's no one specific cause. Like I said, sometimes it's food, sometimes it's stress, sometimes it's hormones, sometimes it's, fecally impacted. I've had a couple of people lately who have been backed up and been quite constipated and had a colon full of stool. What that means is that they're constantly feeling full, they're constantly feeling bloated, they're constantly feeling gassy. And we've found that once we've cleared that, everything has settled down and become a lot calmer. So sometimes it can be something like that. Sometimes it can be to do with the pelvic floor muscles. So we have this thing called abdominophrenic dyssynergia that can be a result of misfiring communication between the stomach and the pelvic floor. So there's a whole range of things that can trigger IBS symptoms and trigger a flare. So how are we going to manage it? So the absolute very first step of managing a flare is to, I always say to people, get back to your baseline diet. So IBS, when it's food related, it is related to threshold, and we want to get, if you're getting symptoms, it means you're over your threshold. We want to get you back to your baseline diet to bring you down underneath that threshold again, so that your gut nerves can relax and start recuperating and recovering from that stimulus. So if FODMAPs are your trigger, we want to get you back to the baseline low FODMAP diet. If it's a food chemicals that are your trigger, we want to get those food chemicals out of your diet. And we want to get you back there as far away from that threshold as possible. The other thing that I always think a little bit about in terms of diet and managing a flare is that there are certain foods that are known gut irritants. So it might be things like spicy foods, caffeine, fizzy drinks, fatty foods, coffee, alcohol, those sorts of things. Now, these foods can be gut irritants, which means that if your gut's nice and calm and you're feeling good, you're probably going to be able to have that stuff on a fairly regular occasion. However, if you've got a sensitive gut, when you overdo these things, they're going to impact your gut you're going to respond more easily than somebody who doesn't have a sensitive gut. So if you're in the midst of a flare, it's always a good idea to sort of pull back on some of these gut irritants as well, because the last thing we want to be doing is irritating the gut when it's already cranky and responsive. So you might just pull back on some of these things. You might sort of return to a fairly bland, fairly plain diet. I know for me personally, toast with Vegemite has always been my go-to whenever I've been feeling unwell. It's always been the first thing that I eat again after being sick, and it's something that to me it feels very soothing. I know other people talk about things like chicken and rice, mashed potatoes. So those very plain, bland foods are always really nice to come back to when your gut's feeling cranky, and they're likely going to be the best tolerated foods. So that's our step one. Get back to your baseline diet, pull any irritants out of your diet, and just be really gentle and kind to your gut. Step two, you want to be kind to yourself. How you think about your symptoms will affect and influence how you experience your symptoms. It's really easy when you start getting those symptoms to start ruminating on it and start getting stressed and start getting worried about it. And the thing is, the more stressed you get about it and the more concerned you get about it, you'll start looking for it, and it will start to be more irritating, and the symptoms will get worse. We really want to try and pull ourselves out of that circle or that snowball or that spiral of what's going on in terms of mental health when the symptoms are occurring. There are lots of strategies that you can use to do this. I find one of the things that really helps for myself is actually acknowledge the emotion that I'm feeling as a result. So if I'm feeling anxious or feeling stressed, actually acknowledging that and saying to myself, hey, I'm having symptoms and it's making me feel anxious, or I'm feeling stressed about having these symptoms. And sometimes that's just enough to sort of pull us out of that cycle and pull us out of that spiral so that we can be more objective and we can start getting strategies to address the symptoms. Having symptoms is not a sign of failure. It doesn't mean you've done anything wrong, and it doesn't mean that you have to restart anything, and it doesn't upset your progress. So if you do get symptoms and they're making you feel anxious, say, hey, I've eaten something, it's flared my IBS, it's making me feel anxious, but that's actually okay. That's a normal response to having an upset gut. And sometimes that's all we need to do. Other things that that can be really helpful. When you calm your mind, you also calm the nerves in your gut, because you calm that fight response and you calm that cortisol result. And if we can calm the fight and flight and calm the cortisol, then your gut nerves are also going to calm down too. So if you've got any activities that you find soothing or calming or relaxing, this is when you want to start pulling those things out. I really enjoy a guided meditation. If you're somebody that wants to curl up on the sofa and sip on a hot cup of tea and watch Netflix, absolutely 100%. If that makes you feel good, that's the right thing for you to do. The other thing that I like, that I always feel better after getting outside and going for a walk. So I find that really resets my mind and it resets my soul as well. Other people, reading, listening to music, yoga. Yoga is amazing, and actually yoga is really good. There's some good poses and stretches that are good for sort of clearing excess gas as well. And we do also have research that shows 2 yoga classes a week does help with IBS symptoms and help prevent them. So that's a great option. If you're too gassy to be going to do it at a yoga studio, by all means, there are some great yoga things on YouTube. And there's a couple of apps that are great. So you might do it in the lounge room and open a few windows. Things like gut-directed hypnotherapy, all of that stuff is really, really, really helpful for sort of calming the gut, calming your mind, and calming yourself and calming your emotions as well. So that's our step 2. Step 1 is pulling back on your diet and going back to bland, plain food. Step 2 is being kind to your soul as well as to your stomach. Which brings me now to step 3, and step 3 is where we treat those symptoms. Now, if you Google on the internet, and look, this is a question that we do get asked every so often, is that people say, I've got symptoms, what can I take to take those symptoms away? Time is the best cure for IBS symptoms. You've got to let that pass through, you've got to let it go through your gut, and if you've had good results with whatever diet you're on, with your low FODMAP diet, time will be your best answer, because it will pass and you will start feeling better again. That's the really cool thing. If you've had great results with a FODMAP diet, you're not back into that cycle of not knowing when it's not going to finish. You know that it's going to pass, and it's going to pass within a day or 2, and you're going to start feeling good again. So time, there is no magic cure that is going to take that away other than time. However, we can treat these symptoms, and there are a few different ways to treat these symptoms. Now, this little section comes with a disclaimer. This is not medical advice, and it's intended for educational purposes only. I always advise, when it comes to things like medications and supplements, speak to your doctor, speak to your pharmacist about what's right for your specific situation. There are things that we called contraindications, which means that a specific supplement or a medication may not be suitable for your needs for another reason. I don't know that stuff on social media. Your doctor, your dietitian know that stuff, so they are the ones that can say yes or no, this is right or wrong for you. All I'm providing is what the options are, what the options do. From there, I highly recommend speaking to your healthcare team about what is right for your situation. And my advice and my information does not override that of your own healthcare team, and it's not intended to do that. So that's my little disclaimer to keep the lawyers happy. Now, first things first, and this is something that I used to use in my nursing days as well. For those who don't know, I was an anesthetic recovery nurse for a long time. before I became a dietitian. So I've been a dietitian for nearly 10 years now. I was an anaesthetic recovery nurse for 20 years. So yes, I started work when I was 2. But anyway, one of the things that I learned when I did a lot of gynecology surgery and stuff when I was doing my nursing, and we often had women waking up after gynecological surgery in the recovery room with a lot of cramping and a lot of pain in that area. Do not underestimate the benefit of a really good heat pack. It works absolutely for period pains. It works absolutely for cramping and things in that area post-surgery. It works absolutely for IBS symptoms as well. That heat is relaxing and it will relax those nerves, and if they're feeling all tight, it will help them relax. So absolutely don't underestimate a heat pack. And I would say that in terms of treating IBS symptoms, I actually think the heat pack is the absolute best of all of them for a sore tummy. So if you haven't got one, get one. Highly recommend it. Peppermint. Peppermint relaxes smooth muscles and it reduces cramps and it aids with gas clearance. So you can sip on peppermint tea. You can also get enteric coated peppermint capsules from the chemist. So something like Mintec, IB Guard. It's peppermint oil in a capsule. That capsule has got a coating on it. So first of all, the oil is intended for human consumption because most essential oils are not safe for consumption. Something like Mintec, IB Guard that you can get from your chemist, it is prepared for human consumption, so it is safe. It's also got a coating on it, and what that coating means is that it survives the acidic pH in the stomach and it gets down to the intestines where we want it to get to relax that smooth muscle. So peppermint can be really useful for that. Just do be careful if you have reflux, then peppermint can also relax that sphincter at the top of your stomach as well, and it can worsen reflux. So may not be suitable if you have a lot of reflux, but certainly if you've got a lot of gas and you've got a lot of cramping, peppermint oil can be beneficial for that. Ginger and iberogast, these absolutely can help with things like bloating, reflux and nausea. So ginger has got some great stuff behind it for use in nausea, and we use it a lot for things like morning sickness as well. Iberogast, it is the one supplement that does actually have a clinical trial behind it that shows that it can help with stomach emptying and relaxing that stomach muscle. The thing with iberogast is that we do find that it works better if you take it regularly 3 times a day, every day. It works as a prevention. It works better as a prevention than a cure, but it can also sort of help calm that gut a little bit as well. So ginger and iberogast are good options. Fiber supplements. I think when it comes to supplements, fiber is the thing that I use the most with my patients, and the thing that and obviously because I find it very effective. So fiber essentially acts like a bit of a sponge. It's not digested. It goes in one end, that passes through, it comes out the other end. As it goes through, it acts like a sponge and it soaks up water. If you've got lots of loose watery bowel movements, then fiber will soak up that water and it will make the stool more formed and you will get more complete bowel movements. So fiber is really useful for diarrhea. If you have constipation and you've got small hard stools, fiber will act like a sponge. It will soak up water. It will make that stool bigger, softer and bulkier and easier to pass. So fiber is for constipation and it is for diarrhea, and it tends to bring the stool back to the middle. So using fiber, you are directly affecting the form of your stool to make it easier to pass and make it more comfortable to pass and make it less watery or softer and bulkier. It works. There are different types of fiber, and some fibers are better for different things. So the other thing is that I find with fiber is that it can be quite personal, and it can be a bit of trial and error to find the fiber that works best for you. Personally, I find that some people love psyllium and hate benifiber. I find that some people love benifiber and hate psyllium, and there doesn't appear to be any rhyme or reason behind that. So it can be a little bit of trial and error to try a few different types of fiber to find the fiber that works best for you. The fibers that I use the most in my practice is psyllium, which some people will get bloating with psyllium, but I find psyllium generally well tolerated across the board. PHGG, partially hydrolyzed guar gum, again, it's PHGG is often FODMAP certified, and it's quite gentle, and I find it fairly effective. And K-fiber as well, so obviously I do use K-fiber as well. I know you've all heard me talk about that. I find K-fiber probably the most useful for managing constipation. So I might use psyllium or PHGG for managing diarrhea, and I might use K-fiber for managing constipation. But again, it's trial and error to find the one that is right for you based on your symptom profile and how your gut responds. Our guts are also different, and the way something responds in one person will be different to how it responds in another. So a little bit of trial and error to find the one that's right for you. If things are severe and you're getting lots of diarrhea, then absolutely things like GastroStop, Imodium, loperamide that you can buy over the counter at the chemist. These things will slow down the gut, they'll slow down the diarrhea, and they'll prevent you getting dehydrated for sure. What we do see is that sometimes it will slow down the gut a little bit too much and people will be constipated for a couple of days. That's okay. That will pass as the medication wears off. So don't get yourself stressed that, oh my God, yesterday I had diarrhea and I took a GastroStop and now I'm constipated. Now I need a laxative to treat that constipation. I wouldn't do that. I would usually leave it for a couple. If you've had a lot of diarrhea, your gut's probably emptying out anyway. You may not need to pass a bowel movement the next day. So give it a couple of days to let that settle. Standardly, my nursing, it's been drummed into me that once it gets to 3 days, that's when we start to treat it. So give it a day or two, that's okay. But GastroStop or Imodium, generally for most people safe to take, can be bought over the counter at the chemist, and will treat diarrhea. If you've got a lot of gas, something like D-gas or simethicone can help break up and clear that gas. If you are getting a lot of constipation, then there's a few different types of laxatives that you can use. And look, that's another whole topic altogether, but have a chat to your healthcare team about what type of laxative might be useful for you. Magnesium, Movicol, Osmolax, Senna is, so magnesium, Movicol, Osmolax, fibers, those are suitable for long-term use. Something like Senna or something is a stimulant laxative. They're useful sometimes for acute situations, but not intended for long-term use. So stimulant laxatives are habit forming, and your body becomes used to them and starts to be reliant on them. Your osmotic laxatives, your fiber-based laxatives, they're not habit forming and can be used long-term. Buscopan. Buscopan is an antispasmodic, and this is something that when I was nursing and we were doing things like colonoscopy, sometimes the muscles in the colon could be a little bit tense, and we would give IV Buscopan to relax those tense muscles. Buscopan you can buy in tablet form, again over the counter at the chemist. It does have a warning not to operate heavy machinery after you've been taking it, and it's not something that I'd want people to be taking every day, but certainly can help with cramping and with tight tummies. Stay hydrated. Our bodies are 70% water. You need to keep your hydration up. Hydration is really helpful for digestion. If you're getting a lot of diarrhea, you don't want to get dehydrated, because dehydrated will make you feel tired, it will make you feel exhausted, it will deplete your energy levels. So if you are getting diarrhea, then things like electrolyte drinks and things like that, like your Powerades, your Gatorades, may be helpful for keeping you hydrated. So, quick summary. Diet, get back to your baseline diet, reduce your gut irritants, be kind to yourself, engage in relaxing activities that are going to calm your fight or flight response, and then treat your symptoms depending on what your symptoms are and what suits your personal situation in terms of what things are suitable for your situation. My final thoughts: FODMAPs pass through the digestive tract. IBS symptoms are going to pass. Usually the worst of the symptoms will pass within a day or so, but it can take a little bit longer to feel normal again. Don't beat yourself up. Be kind to yourself. If you're getting one-off flares that are not lasting very long and they're few and far between, you're probably doing the right thing for you. If you're getting more frequent flares, if you're getting unexplained flares, that's when you give us a yell. So at Everyday Nutrition, myself, Liz and Jasmine, we are all Monash trained in FODMAPs. We are all RPAH trained in food sensitivities and food intolerances. And we specialize in helping people manage IBS. So we are here, we do virtual consults. We're more than happy to help you take back control. And we say we resolve digestive issues and make peace with food, because food is really important, and we want food to improve your quality of life, because we all know that if food is impacting your mental health, it is not making you healthier. So that's my little thing. I'm just going to have a flick through. Do we have any questions? It doesn't look like we've got any questions at this stage. So, of course, I'll leave this up in the group. If you've got any questions later on, please feel free to comment them below and I will come back and answer them. If you have a topic that you would like me to cover in future sessions like this, absolutely pop it in the comments below. And I like to talk. So I will add that to my schedule. Next week, so next Friday, we are going to be talking about dairy sensitivity, including lactose intolerance. We might talk about calcium protein sensitivities and a few other molecules that can be in dairy foods. I actually recently presented at a medical conference on this. So Brisbane, Melbourne and Adelaide I went to present on dairy sensitivity. So I'm going to pull that up. That presentation was aimed at GPs and healthcare professionals. So I'm going to pull that up. I'm going to adapt it a little bit for our audience and hopefully you guys will find it useful. So I will post probably next Wednesday or Thursday. If you've got a time that you actually would like me to be doing these live sessions, so Fridays are usually the best day for me, but mornings or afternoons I can usually sort of work around. So if there's a day or a time that you'd really like that would be suitable, let's have a chat about it. Let us know. If you don't tell me, I don't know. So I hope everybody has a wonderful day and a great weekend, and I will see you all later. Bye.